Welcome to another edition of Back Talk, brought to you from the Southeastern Studios in Mount Pleasant, South Carolina. Each episode, you'll hear from board-certified physicians as they explore the latest in medical procedures that are now helping get more and more people out of pain and back to their active lives.
Dr. Brian, how are you doing?
Doing pretty good.
Fresh out of the operating room, I see.
Yes, just finished up.
Yeah. How'd it go over there? Pretty good?
Went well, yeah.
I saw you over there earlier, and you were doing, I think you were doing a fusion on somebody, and it went pretty well, went pretty quickly.
Correct, yeah. I did a lateral fusion, so kind of going in through the side, fusing it.
Yeah. So think back, like, I like to think about this sometimes, just trying to think about, like, when I first started out, how long stuff used to take me to get done, and how long it takes me to get stuff done now. What do you think about that? Like, you ever think through that, and if so, what are your thoughts?
I think the more you do stuff, the more comfortable you get doing procedures, the faster it gets. Not that it's a race, but you're more efficient. You've seen it a bunch of times, so you're pretty quick going through it. As somebody I know, it's kind of like Guitar Hero. The more you play, the higher your score.
Yeah.
So yeah.
Who's the Guitar Hero player? You?
I know, that's Dr. Paletti's line.
Oh, Dr. Paletti. Dr. Paletti.
You haven't heard that line?
He has no idea what Guitar Hero is.
He doesn't, but he said that line before, for sure.
I mean, yeah, we were talking earlier, and he was like, we were asking him if he could download a video on his computer through email, and he was like, well, I don't know how to do that.
Don't have complex spine surgery. Got it.
Yeah.
Email, not sure.
Yeah. So Guitar Hero, I'm not sure that's his forte. But so you just moved this weekend, didn't you?
I did, yes.
How's that going?
Pretty good. We're in the process of getting out of town. It's just gotten too busy. I mean, I grew up in North Charleston and then went away for school, came back. We were in Mount Pleasant, and it just was getting too busy for me. Need a little space.
Yeah. And how are the kids dealing with the move?
We're kind of living out of boxes right now for this week, but we're unloading quickly. So they're doing pretty well. They like having the space to run. And
you have, what is it, 7 or 8 kids?
Four kids, yeah.
Yeah. And they're what, 9 months apart each?
They're about a year and a half apart. So a year, 2 years apart, yeah. So from 14 to 6. So.
Yeah. Yeah, we stopped at 2, and because we could foresee that once you hit 3, life is, basically over.
Yeah. I wonder what we did with our time before we had the kids. That's for sure. Yeah.
No, I know you love your kids, and you guys have a great time, but you gotta manage your time in the operating room, and then get home and move in and all kinds of stuff, right? What do you guys still? What are y'all working on in the house right now?
So it was a complete renovation on the house. The house is 100 years old, so we had to redo everything. Almost all of it is finished at this point. There's some minor stuff in the kitchen. We're working on the cabinets. The countertops are custom, so they have to, measure and cut them and everything. So we're waiting on that. But other than that, then it's some landscaping on the outside. But getting there.
Do you use your surgical skills when you're
all the time?
Putting stuff together at the
sure.
At the house?
Orthopedics is not that different than carpentry, right?
Yeah.
So
like you're an orthopedic spine surgeon, obviously, and your training was what, 5 years of ortho and then 2 years of spine?
1 year spine, so 6 years total, 5 years ortho.
And you did your fellowship in, I think, St. Louis?
Yeah, so I was at WashU in St. Louis.
Yeah. And so I'm not an expert on all these different programs, but I do know that St. Louis is a big time program, and a lot of major spine surgery is done there, like a lot of scoliosis surgery.
A lot of scoliosis, yes.
Yeah. And I really honestly didn't do any scoliosis surgery in training. That was done mainly by the orthopedic surgeons. And but it certainly does, I think, train you to it's a lot of work. It's a lot of some repetition, but a lot of work that sort of hones your surgical skills, I think. And it must be nice when you get a little minimally invasive operation to do those, because contrasting that with a big scoliosis surgery, those are hard operations, aren't
They're
they?
hard operations. They're complex. They're long operations. The patients, it takes a little bit to get over those things, right? So it's a big surgery, usually a big incision. At least the old ways of doing it were a big incision. So patients took kind of months to get over it. So yeah, doing minimally invasive, surgery, small incision, fusions. I mean, it's great. It's a straightforward operation. The patients do particularly very well. The recovery's easier. It's just kind of a win. The complication rate, that's what I noticed. The complication rate is so much lower when you're doing small incisions, right? It's the anesthesia's less. So the patients seem to have less trouble with postoperative ileus or passive bowel, having bowel movements afterwards, just getting up and mobilizing, they just move faster, less pain. So it's a great operation.
So like when I'm seeing patients in the office, I'll refer a lot of scoliosis patients to you and Dr.
Sure.
Frisch, and I don't really have a good feel for who is going to be a good candidate for. And I know there are numbers that people go by in terms of how bent over the spine is or how angulated the spine is. But how do you decide, since it is a major surgery, and yeah, we do minimally invasive scoliosis surgery, but how do you decide who is a good surgical candidate?
Yeah, so I mean, we try and treat people non-operatively, right? So if we can avoid surgery, we can. So we try and do all the other things, So first off, for a scoliosis type patient who has a crooked back and they're, not standing upright, the question is how bad is their pain and what's their alignment? So can they stand upright and walk, or do they have, nerve pressure and pain in the legs? Because a lot of times it's not just a scoliosis; it's usually some stenosis or pressure on the nerves. So kids, scoliosis in kids, they don't really usually have nerve pressure. It's just a deformity or a curve that can get worse with time. For adults, it's oftentimes just not the curvature and the malalignment where they can't stand up. It's also nerve pain, so they have radicular pain or sciatica or claudication, where they have this really bad pain kind of in their buttocks when they stand and walk that goes down their legs. So it's kind of figuring out where their pain is. Do they have those nerve symptoms, or is it all back pain? Have they failed the kind of standard treatment routes with, therapy and, anti-inflammatories and injections? And then, can they tolerate the operation? Is it, someone who's a little bit older and has some medical problems where they might not be able to tolerate a big scoliosis surgery? Because even though we're doing small incisions and we're doing kind of fancy fusions through small incisions from the side, it's still, a big operation.
How much more common is adult scoliosis in women compared to men?
It's a good question.
I mean, it seems like to me that it's predominantly women, but I don't see that as much as you guys do. But to me, it seems like it's definitely more women.
I mean, I think that I think it's more common for adults. I see both. So I see men and women. So, but yeah, I think that, I'm not sure what the numbers would be exactly, but I see more frequent women with scoliosis.
Yeah. The one thing that I notice in doing surgery, which I don't know if we've talked about this before, but I find that women are way more, have way higher pain thresholds than men. Have you noticed that?
I think so. Yeah.
Yeah.
For sure. Yeah.
I mean, I hate to, beat up on my own gender, but, younger men in particular seem to have they can have a hard time with even the smallest surgeries. But maybe that's just my experience. I don't know.
Patients, yeah.
Yeah. You don't think so?
No, I agree with you. I think that younger males are.
You're allowed to generalize and stereotype if you want.
I think part of it is, especially with lumbar surgery, right? They have big paraspinal muscles.
Yeah.
We're kind of splitting it. So I think they have more pain with that. Even though we're not cutting muscle and stripping off the spine, you're still splitting it. And I think they get more pain from the paraspinal muscles or their back muscles. When you're a little bit older, if you're female, some of that muscle's atrophied, and it's not as hard to retract when you're going through it to do the operation. So I think that plays a factor in it.
Yeah.
But
I think that's definitely true. But I do think that women in general are more stoic than men.
Sure.
When it comes to recovering from surgery.
Sure.
So doing the minimally invasive stuff helps a lot with that muscle
correct
reaction, muscle pain. So I think that's definitely an advantage.
What I see with the minimally invasive, compared to because I train doing all open, so not minimally invasive, is the adjacent segment disease. So how many times, how often they break down above or below a fusion. It seems like that was really common when I was doing open surgery and training. And now that I do minimally invasive, that rate is a lot less.
Yeah, I agree. I think that that especially like in the cervical spine, and patients are surprisingly aware of this idea when they get a fusion, that they could break down the level above the fusion or the level below the fusion, and that's, I think, a generally known sort of, it's not really a complication, but it's kind of a known downside to surgery that I find a lot of patients tell me, I don't want to have surgery. I don't want to have a fusion because then it'll be like a domino effect on the spine. And that can happen in rare situations. But what I've noticed with the new standalone cages that we're using, and those are, 10 or 15 years ago, we used a bone graft between to replace the disc, and then a plate on the front of the spine. And with these new spacers, I think the rate of the level above or the level below breaking down is less than it used to be. And you've seen the same thing maybe in the lumbar spine?
100% agree with the cervical, so the neck, as well as the lumbar spine.
Yeah.
I mean, I think that the old way of doing it with the plate sitting on there, I think that it was tough, right? You're trying to put a plate over top of the graft. So some people would make the plate a little bit bigger. And if you get it close to the adjacent segment or the disc above or below, I think it wears faster. So I think that is something I see a lot less on adjacent segment disease because of the smaller plates. And same thing applies for lumbar spine.
Yeah, and in the lumbar spine, I think, when we do muscle splitting incisions, instead of doing, more traditional cuts through the muscle, and we put screws in the spine, I think the injury to the joints is probably significantly less, and they stay healthy longer. And there's less chance of the level above the fusion having a problem or the level below the fusion having a problem. Do you agree with that?
I definitely agree with that. I think that's definitely the case for the lumbar spine, because if you're doing open surgery and not minimally invasive surgery, you're exposing that joint above. You're trying not to damage it, but you're looking at it to get out to the bone on the side of that to put the screw in. And so you're exposing the facet joint. You try not to disrupt it, but you're exposing it. So I think you're causing some damage to it. Whereas the minimally invasive, you're doing it percutaneous with an x-ray machine, and you're not disrupting that joint or disturbing in any way to split the muscle.
Right.
And I think that's a big deal.
We hope you enjoyed this edition of Back Talk and learned something new. Look for other podcasts from Southeastern Studios as we explore the latest in medical procedures that are helping more and more people living in pain get back to their active lives.